afternoon. I'm Dawn Fuller. I'm a nurse practitioner student at Auburn University. Today I'm going to be talking to you about ascites and the pathophysiology of ascites. Ascites is the buildup of fluid in the abdomen between the lining of the abdomen and the organs in the abdomen. There are two types of ascites: benign, non-cancerous, and cancerous. There are several risk factors involved in ascites. Some of those are medical, being cirrhosis, heart failure, infection, and pancreatitis. The other being cancerous, which can come from the ovaries, the colon, the pancreas, uterine, lymphomas, lungs, and breast. The anatomy and location of ascites is in the peritoneum in the abdominal area, always between the lining of the abdomen and the abdomen's organs. The pathophysiology of ascites, it most commonly occurs in cirrhosis, which is involved with the liver, and most commonly occurs with the over-ingestion of alcohol. There are three different theories that are involved with ascites. The first one is an overflow theory, where renal sodium is retained and is stimulated by portal hypertension. This causes the intravascular hypervolemia and the overflow or weeping of fluid into the peritoneal cavity. The second theory is the underfilling theory, where the hepatic sinusoidal hydrostatic pressure increases and the plasma amniotic pressure decreases, causing weeping of the lymph fluid from the surface of the liver. And finally, you have a peripheral arterial vasodilation theory or forward theory, which actually is a combination of an overflow and an underflow theory. This is the most commonly accepted theory. Portal hypertension and splenolymphatic vasodilation occurs, and when this happens, the fluid transudation and lymph formation produces ascites in the abdomen. Some of the clinical manifestations of ascites are abdominal distension. As you can see by the photograph, there's an increased abdominal girth, there's weight gain, there's a bulging navel, there's abdominal discomfort that could cause shortness of breath because of the pressure on the diaphragm, and bulging flanks. One of the diagnostic tests as clinicians that we can do is called the fluid wave test. You would have the patient place their hand midline of their abdomen. The clinician would tap on one side of the abdomen with their hand on the opposite side of the abdomen, and you can feel the movement of the fluid in the abdomen causing a wave-like effect. You can also check for shifting dullness, a pulse sign, and bulging flanks. So, if nothing else, I don't always throw my hands in the air, but when I do, I wave them like they just don't care. Cirrhosis is, again, the most common cause of ascites, which is the ingestion or over-ingestion of alcohol. As you can tell, this gentleman likes his vodka. We always like our beer, so we have a bunch of love handles. And if I ascites, I tap that too. Some of the treatments available for ascites, first of all, are rest, a low sodium diet to decrease the retention of fluids. If rest and a low sodium diet are not successful, they can use diuretics, which is a second line therapy. We can use a paracentesis, which is a sterile procedure where fluid is actually drawn off of the abdomen. If the diet rests, diuretics don't work, and a paracentesis does not work, you can also use a shunt, can be placed surgically, which is very rarely done. If it is a cancerous ascites, they will come in and they can do a cryoreductive surgery and chemotherapy to reduce the ascites in the abdomen. I hope you've enjoyed the presentation today regarding ascites. Thank you for your attention. Have a great day.